Hello everyone, welcome to Yellow Pages Nursing. In today's video, we will be discussing about ISBAR, a communication tool. Before entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. Let's get into the topic. ISBAR communication tool. The learning objectives we will be discussing in this session will be: what is ISBAR communication tool? What are the purposes of ISBAR communication tool in nursing? What are the uses of ISBAR communication tool in nursing? What are the components of ISBAR communication tool? And how to use ISBAR with an example. Let's get into the session. ISBAR tool is commonly used in healthcare as a structured method of communication, especially during handover or conveying critical information about a patient to the healthcare worker. ISBAR helps to provide a structure for an interaction that helps both the provider of the information and the receiver of it. This tool is a slight adaptation of the SBAR tool, which was developed in the United States Navy for standardizing important and urgent communication on nuclear submarines. Now, coming to the purposes of ISBAR communication tool, it provides a standardized structure for communicating between healthcare providers. It is used for all types of handovers or shift changes during the circumstances like patient transfers to another ward or area, during shift-to-shift handover, during patient transfer to a test or appointment, during inter-hospital transfers, etc. It also helps to prioritize information for decision making. It decreases the chance of forgetting relevant information about the patient. Next, ISBAR communication tool in nursing. ISBAR is a structured and standardized communication tool used in healthcare, particularly in nursing, to facilitate clear communication between healthcare professionals. And this tool is used in various situations. For example, nursing handover and taking over. During shift changes, nurses use ISBAR to communicate important information about their patients to the other nursing staff who take over the patient in order to ensure the continuity of patient care. During transferring a patient. While transferring a patient from one setting to other setting, ISBAR helps in providing a comprehensive overview of the patient's status, medical history, and current needs. During critical situations, in emergency or critical care situations, ISBAR provides quick and clear information about the patient picture, and this will be useful for decision making. During consultations and referrals, when consulting with other healthcare providers, either within the same team or from different disciplines, nurses can use ISBAR to communicate relevant patient information. During documentation, the use of ISBAR in verbal communication can translate into documentation practices. Nurses use a similar structured approach when documenting patient information. Next, what does ISBAR stands for? This acronym stands for Identification, Situation, Background, Assessment, and Recommendation, and it serves as a guide for conveying crucial information during patient handovers and other clinical interactions. Let's discuss them one by one. First component of ISBAR is Identify. Identify yourself, who you are talking to, and whom you are talking about. The nurse clearly identifies themselves, providing their name, role, and any other relevant information to establish their identity. And in the same way, nurse identify the patient by using minimum 2 identifiers: patient name, age or sex, medical record number. Some highlight the patient details in the first component of ISBAR and some highlight in the second component of ISBAR, that is situation. Now next comes situation. It includes providing a brief overview of the current situation or reason for communication. Some outline the patient's name, age, along with reason for communication. Now next comes the third component of ISBAR, background. What is the relevant background? Provide relevant clinical history includes admission diagnosis, that is the main reason for admission, medical history, that is key medical history, chronic conditions example, diabetes mellitus, hypertension, COPD, etc. Recent treatment or procedures, that is any surgery or summary of recent interventions, current medications, including list of current medicines, and allergies, that is patient's known allergies. Next component is assessment. What is the relevant assessment? This requires the interpretation of the situation and background information. Example, vital signs, including relevant vital signs like heart rate, respiratory rate, blood pressure, temperature, oxygen saturation, and pain. GCS, that is Glasgow Coma Scale. A to G assessment. Current symptoms, describing any changes or new symptoms. Physical assessment findings, which includes a concise summary of the physical assessment. Laboratory or imaging results, highlighting relevant results. Next component of ISBAR is R, that is recommendations. This includes immediate actions taken, that is, describe any immediate interventions already initiated. Recommended interventions, here specify recommended actions or changes in care. Follow-up plan, propose a plan for ongoing monitoring or further assessments. And finally, provide an opportunity to the listener to ask questions. Next, let's discuss an ISBAR sample script with an example. Here comes an ISBAR script for a nurse communicating with a colleague during a shift handover. So let's see how to proceed with ISBAR. Identification. Hello, my name is Shamim, registered nurse, and I am the primary nurse for Mr. Alex, who got admitted under Dr. Jack. Next is situation. Mr. Alex, he is 72 years old with a medical registration number following, admitted for pneumonia diagnosis, and I have been taking care of him since today morning. Today, he has been complaining of shortness of breath and SpO2 has dropped to 88% on room air. Next is background. Mr. Alex has a history of diabetes mellitus and hypertension. He has been on antibiotics for pneumonia and we have started him on a nebulization treatment every 4 hours. Next is assessment. His vital signs are as follows. Heart rate is 90 beats per minute. Respiratory rate is 22 breaths per minute. Blood pressure is 140/80 mmHg and temperature is 100.2 degree Fahrenheit. On assessment, he is using accessory muscles for breathing and breath sounds indicate increased wheezing. Next is recommendations. Inform the physician about Mr. Alex's condition and have started oxygen at 3 liters per minute via nasal cannula. ABG sample has been taken and the report shows respiratory acidosis. Monitor vital signs for every hourly, including oxygen saturation. There is an advice for chest X-ray in order to rule out any worsening of pneumonia. So far we have discussed what is ISBAR communication tool, What are the purposes of ISBAR communication tool in nursing? What are the uses of ISBAR communication tool in nursing? What are the components of ISBAR communication tool and how to use ISBAR with an example? So here we go with ISBAR communication tool. If you find this video useful, please like it, share it, and subscribe it. And do not forget to hit the bell icon to receive instant notifications. Thanks for watching. Have a